From KETK, you're watching East Texas Live at 3.
Welcome back. Dr. Gugay with the Sleep Medicine Institute of Texas is back in the studio, and today we're talking about kids and sleep apnea. Thank you so much for being here today.
It is my pleasure.
Yes, sir. So can you just talk to me a little bit about it? So kids can get sleep apnea?
Absolutely. Kids are not just little adults. They are growing, developing, and building their bodies and minds. But sleep apnea can be inherited. And as a consequence, children of all ages, from newborns to infants, from adolescents to teenagers, can all be susceptible to the effects of sleep apnea.
Yes, sir. And so what does sleep apnea look like in children?
Different age groups have different presentations because they're developing and growing, so the sleep apnea symptoms don't look like in adults. For example, in a newborn or in an infant, apnea of infants used to be called SIDS. These babies, they turn blue and suffocate, and some of them can actually pass away. Between years 2 and 6, sleep apnea can manifest as recurrent ear infections, tonsillitis, and lots of other problems like asthma, teeth grinding, nightmares, night terrors. And then from 6 to 9 or 10 years of age, they can start developing bedwetting, ADD, ADHD. They can start having depression from lack of oxygen in their brain, growth abnormalities, difficulty focusing on things, and teenagers can have headaches, asthma, of course, neurological dysfunctions, people with inability to learn effectively. Some can develop speech defects because their tongues have a short frenulum or they appear to be tongue-tied. So lots of different ways to manifest sleep apnea in children. Unlike in adults where they get sleepy all the time, children can be bouncing off the walls. It's the exact opposite.
Yes, sir. And so just talk about the developmental issues that kids can get for having sleep apnea.
Certainly. You know, as a little baby with sleep apnea, if your tongue goes and blocks the air passage in your sleep, then you're going to start doing mouth breathing. And the mouth breathing will breed a smaller mouth, a high arched palate, so their nasal passages get congested. They start developing acid reflux because they're sucking so hard to get air. And that acid reflux can present as asthma, or the bacteria can come up into their throats and tonsils, adenoids and ears and cause recurrent infections. And it may drive the therapy in the wrong direction, like getting a tonsillectomy when actually they needed a sleep study. And so it's the older children, teenagers, the depression symptoms, the weight gain symptoms, these can affect them for a lifetime. High blood pressure and headaches can manifest during that age group. Yeah, so a lot of different things that therefore has to be treated in different ways.
Yes, sir. And so if a kid does have sleep apnea, is the treatment the same as adults?
It's really not. You know, in a newborn, treatment changes completely. We don't put newborns on big PAP machines. They don't have teeth. You can't put an oral appliance in their mouth. You know, so they have to be treated with oxygen therapy, other things. As the child begins to grow, the parents need to be aware that the sleep apnea symptoms can manifest as mouth breathing during sleep, and so they might have to go to the sleep doctor. A lot of times tonsillitis and ear infections get treated with just antibiotics, and that's really not sufficient treatment for sleep apnea. In older children, we put them on a PAP machine. They do really well on a CPAP or a BiPAP machine. We have baby masks for them. And then as the teenagers grow out of sleep apnea with our treatment, they may not need any treatment at all because we addressed it early enough. Or sometimes we can transition them to an oral appliance once they turn 18.
Yes, sir. And so can you just talk about what kind of treatment options there is for if your kid has sleep apnea?
If your child has sleep apnea, you really need to first and foremost go and see a pediatric sleep doctor. There are adult sleep doctors and there are pediatric sleep doctors, such as myself. I've been trained at Children's Hospital of Dallas. We see a lot of kids over the last 20 years. But there are the nuances of various ages. creates a very subtle difference and sometimes very glaring difference in treatment options. And so going to the sleep doctor, getting a proper pediatric sleep study, and then following it up with proper therapeutic management. As the child grows, therapy changes as well. So it's a multifaceted approach to therapeutics.
Yes, sir. Well, thank you so much for coming in and telling us about kids and sleep apnea. For more information about this topic, you can go to the website right here on your screen.